again, it varies from clinic to clinic, but a familial culture, a culture of belonging, a culture of ease, comfort, where you can be who you want to be, practice the way that you want to practice, and get patients better, I think is really the underlying tone, really, of all the clinics and what it's like to work at Pinpoint Health.
Yeah, I think part of one of my roles is that I do all of the healthcare hiring. So I'm actively involved, literally bringing on any new healthcare professionals, dealing with me and whoever the local office manager is. But the initial interaction is with me. Everything is done with me. And the question that I will often get asked the most from practitioners is their expectation of how they're supposed to practice. And my answer is always the same. I don't micromanage that. I don't micromanage the autonomy of a healthcare professional, right? That's you are a healthcare professional. You've done all the hard work to be where you are. I'm not going to be involved in saying that you need to do something one way. We're not that type of company. I've never wanted that. I don't want to impose, this is the way you have to approach this, or this is the way you have to approach that. What I love about Pinpoint Health is the autonomy that and the individualism that all the health practitioners are bringing and bringing their take on it, because really what you want is then that to jive with the patient that they're seeing. And ultimately, I think that's why healthcare professionals like working with us, is that they understand that they, although are part of this group, they have that level of autonomy as individual practitioners to do what they feel is necessary and best for their patient. Right, and that's ultimately what I always focus on. Where my answer is always simple. I'm not micromanaging that. You're a healthcare professional, and so if you want that level of autonomy, that's really what we try to offer, which I think is different in comparison to some other larger organizations out there where there is maybe a little more involvement in that. I strategically have said that I don't want to be involved in that, and simply just because, I guess, simply and biasedly, because I think of myself as a practitioner, I never wanted that. I did not want to be told how I should treat a patient or what I should do to them, not meaning that I wouldn't take advice or anything like that, and we definitely do things around that in terms of rounds and trying to understand different things and continuing education and get better. But ultimately, I want to be able as a professional to be in that room with that patient and have that autonomy to say, okay, here's what I think, patient agrees with what I'm thinking, let's carry out that type of plan.